Hi, my name is Emily. I'm a nurse practitioner student, and today I'm going to be explaining to my patient what type 2 diabetes is and what is going on in the body. So, I have my little diagram here. I'm explaining type 2 diabetes. So, when you eat a sugary thing or any kind of food, your body then breaks that down and it turns into little molecules of sugar, which is also called glucose. So that glucose is going to be then in the bloodstream. And once it goes in the bloodstream, what typically is supposed to happen is the pancreas, which is responsible for making insulin, and insulin is something that decreases sugar in the bloodstream. It takes the sugar from the bloodstream and brings it to the organs for energy. That's typically what happens. But when a patient has diabetes type 2, what will happen is there's little receptor cells on the organs, and the pancreas will be making the insulin at first, but it's not going to be able to get into from the bloodstream to the cell because the receptor isn't working and it's not letting insulin get in to the cell. So that's kind of what's going on with type 2 diabetes. It's all the sugar is staying in the bloodstream. So that's why your sugar is going to be sugar level. When you prick your finger and take your sugar, it's going to be high because those receptors aren't working to get the insulin from the bloodstream to the cell. So that's why that what's going to happen then with some of the signs and symptoms is that sugar is going to spill over into the kidneys, which is where urine is then produced. And what's going to be in the urine is going to be sugar, and sugar and water go together. So not only is sugar going to be coming through the urine, but what we're also going to see is it pooling water. So the patient, you're going to be peeing more probably. That's maybe one of the first signs or symptoms that you see. You're peeing more, or which would then make you more thirsty. So those are two of the signs that we look for. And then the third could be increased hunger because those cells, they're not getting the sugar that they need. Because again, the insulin, the receptor isn't letting, it's like a key, and it's not opening up and letting that sugar get into the cell. So we could see increased hunger. So some of the treatments would be like working on getting those receptors on the cells or on the organs to be working more efficiently. So that can be done through diet, it can be done through exercise, um, and then also what we could do eventually, we may need insulin. First, for type 2 diabetes, we may not need insulin right away because the pancreas will try to keep working, and producing the insulin. But eventually, we may need to use insulin then. And you could also use like an anti-diabetic medication, which would help those receptors to work a little bit better, more efficiently. And then some long-term complications could be issues with your kidneys. It could bring damage to your eyes because that sugar is all in the little vessels and it's so sticky, and it's not letting the blood flow properly through your body, and it may cause wounds on your feet or a loss of feeling. Um, so issues with your skin or heart disease. So that is the importance of type 2 diabetes and understanding the pathophysiology.